Hi learners, welcome back. In this session, I am going to cover topics on dementia and delirium symptoms management. This presentation is prepared by Dr. Geeta Joshi Madam of NAPKAIM. Let us consider the following scenario. 89-year-old man with moderate dementia, diabetes, peripheral vascular disease and coronary artery disease admitted to the hospital with gangrene of left foot resulting in sepsis. He then suffers a small myocardial infarction induced by rate-related ischemia from his systemic infection. What will you do as a palliative care physician? In this scenario, palliative care physicians primarily focus would be on providing comfort and improving the patient's quality of life. Also, ensuring effective pain management for both the gangrene and myocardial infarction, using appropriate medications and interventions. Additionally, prioritizing communication with the patient and their family to discuss their goals of care and ensure their wishes are respected throughout the treatment process. This may involve coordinating with other healthcare professionals to provide comprehensive and holistic care tailored to the patient's needs. In the journey of chronic illness, decisions about care should be made collaboratively by patients and their families. As the disease progresses, it's crucial to offer the option of palliative care, ensuring comfort, dignity, and support every step of the way. Let us discuss a condition that profoundly impacts millions worldwide, particularly as we age: dementia. Dementia is an acquired decline in memory and at least one other intellectual ability such as language, aphasia, capacity to use tools, apraxia, or recognizing objects, agnosia, impairments in executive function, which includes planning and abstract thinking, is also common. The decline should be severe enough to interfere with daily living activities. Dementia is the most common neurological disease in the elderly population. The table outlines early signs of dementia compared to normal aging. People with dementia may struggle with recalling names of close individuals they interact with frequently. While in normal aging, forgetting names of distant acquaintances is more typical. Dementia often leads to frequent forgetfulness of important information, whereas in normal aging, occasional lapses in memory like forgetting minor details of experiences are common. Those with dementia may repeat stories or phrases within the same conversation, whereas in normal aging, occasional forgetfulness in completing tasks like misplacing items is expected. Dementia can cause unpredictable mood shifts without clear reasons. While in normal aging, mood changes usually occur in response to specific triggers. Dementia may result in decreased interest in hobbies and difficulty making decisions, whereas in normal aging, changes in interests are subtler and less drastic. Now let us discuss on progressive degenerative dementias. Alzheimer's disease is the most common type of dementia, characterized by memory loss, cognitive decline, and behavioral changes. It progressively worsens over time. Vascular dementia results from reduced blood flow to the brain, often due to strokes or other vascular issues. Symptoms can vary depending on the affected areas of the brain. Dementia with Lewy bodies is a condition marked by abnormal proteins deposited in the brain, leading to cognitive decline, visual hallucinations, and movement difficulties resembling Parkinson's disease. Frontotemporal dementia affects the front and side regions of the brain, leading to changes in behavior, personality, and language abilities. Understanding these different types of progressive degenerative dementia is crucial for accurate diagnosis and appropriate management. Now let us discuss on the clinical characteristics of dementia. One of the important characteristics of dementia is the gradual loss of independence experienced by those affected. As the condition progresses, individuals may find it increasingly challenging to perform daily tasks and activities they once managed effortlessly. To understand the course of dementia, we often categorize it into 4 stages: mild, moderate, severe, and terminal. Now let us talk about the mild stage of dementia. Memory problems. Individuals may begin experiencing difficulties with memory, such as forgetting recent events or names of familiar people. Spatial disorientation. Individuals may struggle with navigating familiar places or recognizing their surroundings. Personality changes. Individuals face mild changes in personality and it become noticeable, such as increased irritability or mood swings. Need assistance or reminders with basic activity of daily living. Individuals may require reminders or assistance from others for doing daily basic activities like grooming or meal preparation. Now let us discuss on the moderate stage of dementia. Language difficulties. Communication becomes more challenging with individuals experiencing trouble finding the right words or forming correct sentences. Difficulty with utensils. They may struggle to use utensil effectively for eating or performing tasks requiring fine motor skills. Become confused. Confusion and disorientation become more pronounced, leading to difficulty in recognizing familiar people or places. Able to feed themselves if finger food is provided. Providing finger foods simplifies the process due to decreased dexterity. Now let us discuss on the severe stage of dementia. Impaired comprehension. Understanding and processing information becomes significantly impaired. Resistance to care. Individuals may resist or refuse assistance with basic activities, making caregiving challenging. Motor difficulties. Mobility is severely affected with difficulty in feeding oneself and walking independently. Assistance is often required. High risk for falls. Decreased balance and coordination increase the risk of falls, necessitating precautionary measures. Incontinence. Loss of bladder or bowel control may occur, requiring management strategies to maintain hygiene and comfort. Now let us discuss on the terminal stage of dementia. Loss of verbal communication. Communication becomes severely impaired with individuals unable to articulate meaningful speech. Lack of eye contact. Difficulty in maintaining eye contact, further limiting interpersonal connection. Loss of mobility. Even with assistance, individuals may become completely immobile, requiring full support for movement. Swallowing difficulties. Challenges with swallowing increase the risk of choking on both solid and liquid foods. Risk of aspiration. Aspiration of nasopharyngeal secretions becomes a concern, requiring careful monitoring and management to prevent respiratory complications. Now let us talk on comorbidities. Neurological complications. This includes conditions like Parkinson's disease, seizures, and extrapyramidal symptoms, which often accompany dementia. Intercurrent infections. Individuals with dementia are prone to infections such as urinary tract infections, upper respiratory tract infections, lower respiratory tract infections, as well as issues with the skin and subcutaneous tissue. Malnutrition. Decreased intake, increased energy expenditure, and loss of muscle mass contribute to malnutrition, a common comorbidity in dementia patients. In our palliative care approach to dementia, our focus extends beyond merely managing symptoms. It encompasses providing compassionate and comprehensive care. Let us explore some essential aspects of this approach. Sundowning refers to the increasing confusion and agitation often experienced by individuals with dementia, particularly during the evening hours. To mitigate the effects of sundowning and promote a more comfortable and restful nighttime experience for individuals with dementia, several strategies can be employed. Daytime exercises. Encouraging regular physical activity during the day can help reduce restlessness and promote better sleep at night. Consistent bedtime routine. Establishing a calm bedtime routine can signal to the body that it's time to wind down and prepare for sleep. Prevent daytime napping. Minimizing daytime naps can help regulate the sleep-wake cycle and reduce confusion and agitation at bedtime. Control of pain. Ensuring effective pain management to alleviate any discomfort or distress experienced by the patient. Encouraging patient participation. Involving patients in their grooming and bathing routines can promote a sense of independence and reduce agitation. Sponge bath and water temperature. Providing sponge baths and adjusting water temperature can enhance comfort during bathing. Familiar music and social activities. Engaging patients in familiar music and social activities can provide comfort and stimulate positive emotions. Constipation treatment. Implementing a high-fiber diet and osmotic laxatives to address constipation as stool softeners may not be effective. Preventing bed sores. Employing strategies such as frequent turning to prevent the development of bed sores or pressure ulcers. Managing dryness of mouth. Using artificial saliva spray or offering ice chips to alleviate dryness of the mouth and enhance comfort. Ultimately, compassionate and attentive nursing care is essential for the overall well-being of the patients with dementia. When it comes to the palliative care approach to dementia, it is essential to recognize that medicines play a limited role compared to the invaluable impact of individualizing nursing care. While medications can help manage certain symptoms, they should be used judiciously and in conjunction with holistic care strategies. Cholinesterase inhibitors. In early stages, cholinesterase inhibitors like donazepil and rivastigmine can temporarily improve behavioral abnormalities. Low doses of neuroleptics can help in reducing hallucinations, confusion, and delusions. Second generation neuroleptics are preferred as they cause fewer extrapyramidal symptoms, but caregivers should remain vigilant for signs of Parkinsonism. Now let us discuss on delirium. Delirium is characterized by a sudden alteration in brain function leading to confusion and emotional disturbances. It affects cognition, memory, sleep, attention, and other mental processes. Delirium can occur during alcohol withdrawal, post-surgery, or in individuals with dementia. While delirium is typically temporary, it can often be effective treated with appropriate interventions. Let us discuss the different types of delirium categorized by their causes, severity, and characteristic features. Delirium tremens. This severe form of delirium often occurs in individuals attempting to quit heavy alcohol use after many years. Hyperactive delirium. This type is characterized by heightened alertness and uncooperative behavior. Hypoactive delirium is more common. It leads to increased sleepiness and difficulty with daily tasks such as missing meals or appointments. Mixed delirium. Some individuals may experience a combination of both hyperactive and hypoactive delirium with symptoms alternating between the two states. Let us discuss on the differences between delirium and dementia. Delirium, characterized by acute onset, is often reversible and may fluctuate throughout the day. Individuals with delirium experience mental clouding where information is not properly observed, leading to rambling and incoherent speech. Despite their confusion, they are usually aware of their surroundings and may feel anxious. In contrast, dementia is a chronic condition that progresses gradually over time. It is typically irreversible and shows constant symptoms. Those with dementia also experience mental clouding, but their speech tends to be stereotyped and limited. Importantly, they are often unaware of their condition and may not exhibit signs of anxiety. Understanding these differences is vital for accurate diagnosis and tailored treatment plans. Let us take a look at the key components of managing delirium. In delirium management, effective counseling of caregivers is crucial, empowering them to support the patient effectively. Correcting underlying issues like hydration and electrolyte imbalances is essential for symptom alleviation. Non-drug measures such as creating a supportive environment and orientation techniques play a vital role in reducing agitation and confusion. Consider pharmacological intervention when non-drug measures are sufficient to manage severe symptoms. Haloperidol may be used to address agitation and psychosis, while benzodiazepines may be appropriate for certain cases such as delirium due to alcohol withdrawal. Overall, a comprehensive approach addressing causes and symptoms optimizes outcomes for delirium patients. Thank you.